we were very, very transparent about everything that we did. Our shack meetings are open public meetings, and we advertised that we were having it. We invited people to come and sit down and, be with us as we went through the process of making decisions. And we courted the media, and we had lots of information out there about what we were doing. And as we got closer and closer to deciding that we were going to make some recommendations, we just continued to invite people to come in so that they could, even if they weren't members of our shack, and it's pretty defined about who's a member of your shack and a voting member, but they still were able to have discussion, have their questions answered. Once we did the survey, then we took those results and went public with that. And we did that on our district website. We did that in the newspaper. We did interviews too. So people were aware that we were getting there. Something was happening, and it was pretty exciting. Every time that we spoke about teen pregnancy, we never spoke about it from a concern of kids' morals, whether it's right, wrong, having, intercourse when you're 14 and 15 years old. We talked about it as a public health issue. We actually had collected some anecdotal information that some of the girls shared with us, and it's not required, and we certainly didn't ask for it, but they would tell us what their STI status was as well. And so anecdotally, we collected data that looked like about 94% of our teen moms had an STI. And so that was a very impactful piece of information to share as well, because not only were they pregnant and young, they also had a sexually transmitted illness. So, from a public health standpoint, that's the way that we approached it, not from a morality standpoint. So that worked out, effectively for this community. It's a very conservative community, and we were really pretty stunned that we were successful. And, we're delighted with the program, and it's worked out really well. The implementation has as well. What they cared about was Midland, Texas, USA. And so we just talked about our numbers. We did talk about, this is a national crisis, it's a state crisis, we're concerned about that. But what we're really concerned about is what's happening in Midland, Texas. We try to keep it focused on us, because that's what we care about, is Midland, Texas. And if then you can take what happened here and utilize that someplace else, fabulous. I think our key players for helping get the process started, definitively the shack members. And those people are volunteers, and they're parents, and they're concerned. So they really were passionate about making a change. The school district employees who were part of our School Health Advisory Council also were very passionate about that, and those are child nutrition people, those are people who are PE and health and athletics and teen pregnancy and different folks. We have some curriculum people in there as well. So everybody kind of was on the same page. When we would talk to our superintendent, I think that having the superintendent of your school district a proponent for making a change, and he said to us, this is not acceptable. This is not acceptable. We need to make a change. When you have that attitude that somebody recognizes this is not okay, then you're going to go forward. You truly are. And he is such a respected member of our community, and really transparent as well. And when he would say this is not acceptable, and here's why, and here's what I want to do, and here's how we can help, that voice was very strong. It's not just the voice of Tracey Dees, the school director of school health services. Not that anybody, people can listen to me, but when the superintendent of the school district says that, and when you look at the components of the people who are on our shack, parents, clergy, community members, retired people. We also had 4 high school students on our shack, and we shared that information, so that these are the people who have been looking at this information. So I think it was a pretty good representation, not probably the best representation, but it was a pretty good representation of our community. It is touchy, but when you remove that morality part, where you're not saying this is right, this is wrong, you're not judging anyone, you're just saying sexual integrity is very important. We want our kids to make good decisions for their lives, and we want them to be healthy. And in order to do that, we feel like we can give them some tools to be successful. Just like I'm going to give you a tool to learn how to write a complete sentence, or I'm going to give you a tool to learn how to do this experiment appropriately and not blow up the science lab. Let's give you some tools to help you initially even make decisions about who are your friends. You know, how do you get from, oh, everybody's going to go out and drink, to I can say no to that. Well, that's the beginning. And that's one of the ways that, you know, children are going to learn how to be successful. And if the school district can aid in that, in addition to what parents do, what a great partnership, you know. And it would be lovely to think that every kid who attends school gets that information at home, and that most of them do. But it's nice to partner with your school district to have that information reinforced. And we know from the community assessment survey that we're reinforcing what parents want us to reinforce. You know, we're not creating something new. Our message is not new. It's the message that the parents would like to have reinforced with their students. So that's why I think it's successful.